Title for today's event is Quality Improvement for Patient Benefit. This is a really important topic, and when we designed the CLAHRC programme a number of years ago, we wanted to put patients at the centre of that programme. And Rachel, you've been heavily involved in the work we've been doing around this. Would you like to just give some comments?
Yes, I mean, patient involvement has been a really important aspect of the CLAHRC programme right since 2009. And during that time, we've really evolved the way we've supported a lot of our teams. And I think we've reached a stage now at this event where it feels very much embedded with the work that we do. Teams are thinking differently about it, they're talking differently about it, and I think it's leading us to, I suppose, evolve further how that is built into what we do on a day-to-day basis.
And I think I see that in the maturity of the discussions we're having and also the confidence of the patients who come along to these meetings. Building on that, they were part of the fellowship programme. Would you like to comment on where we are with the Brian Turley Award?
So the Brian Turley Award is an inaugural award for this year, which is in memory of Brian Turley, who was a significant advocate and ambassador for patient involvement and was very much involved in our My Medication Passport work. And he was very passionate that roles that patients had to play and the influence that they had. Sadly, Brian died last year, and we wanted to do something in his memory to recognise the work that he'd done and to encourage others to do the same. So this is our first award, and we've had 7 nominees.
In lots of ways, it was quite a hard thing to judge because the applications were coming from a service where somebody was working with people with hearing difficulty, another case where it was working with people with alcohol dependence, another one where it was severe mental illness. So as you can imagine, it's like comparing apples and pears. These are very different things, but we were looking all the time for evidence of real involvement that was making a difference to the way that the service worked.
So I think the Brian Turley Award is actually a reflection of the maturity of the programme and the confidence that people have, but it isn't just about looking back, it's actually about how we look forward and make sure that we engage patients fully in research design, research dissemination, and importantly, change in healthcare delivery.